Okay. So hi, hello, good afternoon, everyone. Welcome to Homeopathy Musings. Today is a very special session with Dr. Gajanan Dhanapkar sir. That he's on our musings today. I'll just give a few formal introductions and few general details to all the participants. I would like to tell you something about Homeopathy Musings and what we are. So this musings began as an experiment last year during the lockdown in the form of a small study circle in Malad, after which during lockdown we went virtual. After even within no time, a study circle of 7 to 10 homeopaths expanded into a like-minded homeopathic family, which we run on every Saturdays. And why musings? Because that's what we do. Musings is not a formal webinar that you attend generally, but it is a place to muse, reflect, share, and learn homeopathy in an open mic format. As an extension to the Saturday musings that we do every first and third Saturday of the month from 2 to 4 p.m., we also have done an in-depth module on mammals and mollusks, which were a 7-day course module and which were widely appreciated by everyone. Musings family now runs in thousands of homeopaths spread across all the continents of the globe. And this has been done by our mentors, Dr. Prajakta Vaidya and Dr. Preeti Shah, who are the co-founders of Healing Harmony Homeopathic Clinic and the founders of Homeopathic Musings as well. So as I told you all, musings, we do it on every first and third Saturday from 2 to 4 p.m. Live sessions are free for all. Then we also have this mentoring program known as Beat the Blues for difficult cases. Any homeopaths who would bring to us to the panel of mentors that we have with us on every second Tuesday of the month at 2:30 p.m. IST. We have few ongoing courses going on right now, which is known as Basics of Contemporary Homeopathy. So this module is based basically on the pathway of Dr. Shankar and Dr. Sholtin, Dr. Gandhi and Dr. Yakir, in which our mentors, Dr. Anisha, Dr. Preeti Shah, Prajakta Vaidya, Dr. Jyoti Utpi, Dr. Chanda Shah, Dr. Geeta Reddy and Dr. Nirupama Agarwal, with their years of experience, have come together to integrate all these methods in much easier way for you all to understand, with the basics of sensations, miasms, the animal chart, the plant chart, and of course the nozzles and sarcodes as well, and your periodic table. So if you all wish to join us for this course, it's still going on and the recordings are available for viewing. So you can contact us if you want to register for this course. We also have this repertory intensive series going on. We have already completed 3 sessions of the series, and the 4th session is due on 14th of August, which will be taken by Dr. Arshi Tang, Dr. Kushala Salian, Dr. Preeti and Dr. Prajakta. So do join us for these sessions. The recordings are available to all, and you can contact our coordinators for the details. Some basic hygiene factors that I would like to tell you all. Kindly mute your lines. Chats and questions can be put up on the chat box, but will be taken at the end of the session after sir completes their cases and explanations. Also, please ask relevant questions related to the topic today, that is thyroid disorders. Make notes, share your experiences with us, and moreover, enjoy the session. If you have any questions and difficulties, do call or WhatsApp us or email us on the following details that are shared on the screen with the coordinators. I would now like to welcome our guest speaker today, Dr. Dhanapkar sir. Something about Dhanapkar sir I would like to say. Dr. Dhanapkar sir, as we all know, is a beloved teacher and our mentor, and who doesn't know him? He's been practicing homeopathy in Mumbai since 24 years. He's also a consultant and faculty at the Othersong International Academy of Advanced Homeopathy in Mumbai. He has been a guest lecturer in various colleges and homeopathic associations of India and abroad. And he's an invited speaker for seminars in Portugal, Serbia, Bulgaria, and teaching students from Brazil, Croatia, Japan, and many other countries. He has presented papers at National Conference of Homeopathy on the topic studies of carnivorous plants and homeopathic understanding. He is an author of the book Conquering Fevers with Homeopathy, which is famous among the homeopaths in India and abroad as well. And he has now written another book that is Conquering Thyroid with Homeopathy, a pathway to success in thyroid and related disorders. His special attention in acute conditions, pediatrics, endocrinal and pathological ailments, their management, and with parenteral education and counseling is well received by patients. And his cases have been featured in different homeopathic magazines, and the book Insight into Plants, Volume 3, written by Dr. Rajan Shankaran. He's also known for his unique style of case taking, case analysis, and lucid way of case explanation, which is well appreciated by students who learned in his clinic. So I welcome Dr. Dhanapkar sir today to Homeopathy Musings. We are glad and honored to have you, sir, today. Dr. Prajakta Vaidya would like to say a few words for you. Ma'am, can you?
Yes, yes. So, sir, we welcome you and we are very, very happy to have you with us today and to share your experience. I think in our practice, me and now Preeti, we've been reading your cases in the Fever book, and I think I have attended the launch of that book also. So during the actually the practice, when it comes to acute, it's really a task, no, for homeopaths to prescribe. But I think it was because of you, especially during fevers, and that book has really helped us in the whole practice. And I think it's a story for all of us over here. Yeah, so we warmly welcome you today and looking forward to learn from you always.
Thank you.
Thank you, sir.
Thank you very much. So, should we begin?
Yes, sir.
Manali, it's all up to you. When you say begin, I'll start it.
Yes, sir, we can. We are most eager to hear from you, sir.
So, at the outset, first, I would like to thank you as a group, Homeopathy Musings. It's nice. I heard all females here.
Yes, sir.
A big female bar coming up. It's very nice. And I saw your curriculum. That is also a very good thing that you're doing.
Yeah.
Feel very, energetic now that you all are doing such a great work. Congratulations and very happy for you.
Thank you, sir.
Today we will be starting with a topic. Just tell me the screen is being shared. Manali, you have to allow me. You have disabled me. I need to share my screen.
Can you check it now, sir?
Yeah. Can you see the slides?
Yes, sir.
Okay. So today I'm going to speak about managing thyroid disorders with homeopathy. Now, this topic was in my mind for many years. In fact, there are many topics that I have been working on, but this was for many years that I was thinking about it. How should we come to some kind of a treatment plan where we can succeed? Because since many years, we have been having huge amount of patients coming for thyroid disorders, and we have been successful also. But sometimes there are some things that lead to the relapse. There are many cases which don't hold good for a long time, especially when it is autoimmune thyroiditis and so many other things. So that is the reason I thought of working on this book in detail, this topic in detail, and writing something as an experience. So today I would like to urge all those participants who are listening me for the first time on this chapter to focus on the way I am looking at thyroid rather than just having only questions, because I have tried to approach thyroid in a slightly different way so that we don't miss anything. So you're welcome to ask me any questions. I love being questioned, but try and understand the pattern of thinking which we inculcate now in understanding thyroid. Nothing is going to change for you. It will be an addition, but there will be some very important thing that can happen is you may not miss something. So I urge all the participants, especially the junior practitioners, to focus on the way that we are now going to introduce to look at thyroid. So today, if you look at the global scenario, we have a huge amount of population that suffers from thyroid disorders. And if you see the male population and the female population, that much amount of female population suffer from thyroid disorders. And we all know about it because it's not only thyroid. Now, thyroid club with PCOS is a big influx now in our patients today. And this is what we need to actually work on because the modern medicine doesn't have much to give here. And we can really score and give a better life without the bad effects of the modern medicine. So this is something that all the juniors and all the practitioners, I feel, should focus on because this is the disease which is related to the lifestyles. And a lot of people will also get affected with this because of our lifestyle, which is now affecting thyroid and the hormones that been infused into the younger generation because of the rise in PCOS. So these are the world statistics. This you can even see on your detailed study on the net. But why we as homeopaths should focus on thyroid disorder? One reason is the huge amount of population that is suffering from it. Secondly, since it is a lifestyle related disorder, since it is a stress related disorder, in many cases, homeopathy will have a very good answer. Third, because of hormones, lot of hormonal imbalance that take place, I think we as homeopaths have a huge role to play in such kind of cases. Now, you see the present situation. What we do, we use a conventional approach. Like you will come to the constitutional remedy, then the intercurrent remedy, or maybe give a specific pathological remedy. And it works in many cases. And we all have our successes with the single drug remedy that we have given. But I am not speaking on those cases where you are successful in that one single dose or for that one remedy that you have given. I am now speaking on those cases where we failed. This is one reason that I ventured into this topic. So many a times when we fail, we look back and we give empirical mode of treatment. Either you retake the case, change the constitution, or you give the remedy that follows well, or you have some remedies that are given as specifics. And when you give specifics, you know the results are by chance. So that is something we should try and avoid. So why it is happening that we are missing these remedies? And why only some teachers or some of the great homeopaths can do it? It is because that there are some smaller remedies which are mentioned by our great teachers, but they did not come into the repertory. So on repertorization, they won't come. So how to understand those remedies? A lot of the senior practitioners used to come to those remedies because they had a tons of experience behind them. But for the juniors, it will take time unless until you read the Materia Medica completely from that particular author and understand it. Because most of the authors have written these remedies in one-liners, very difficult to correlate. And that is exactly what we tried and studied to understand how thyroid acts. The newer approach is not something which is different from the older one. So what we have to do is you have to finish taking your case the way you have been doing it before. You come to the constitutional remedy. Whatever may be the constitution, please come to the constitutional remedy. This approach is an extension of the old. Now what we will do is we will have to correlate the pathological condition, the investigations, the understanding of Materia Medica, and find the homeopathic simillimum on those points which generally get left out in case taking. We used to believe that there are so many things that gets into the case taking, even if you have missed it. Like for example, if a patient has a thyroid problem at the time of pregnancy or during puberty, so we give remedy not well since puberty, but this may not be the most specific medicines for thyroid disorder since puberty. So do we have some medicines which are only having an action at thyroid during puberty? Yes, we do have. So that microscopic study, like for example, if you have during menopause, then what to do? So you have so many remedies that works during menopause and in relation to thyroid disorders. You have a patient with uremia and having a thyroid disorder. So what remedy will act? So we have great teachers who have done studies on these pathological conditions which are influencing the thyroid. So these smaller remedies were given in the Materia Medica, which we did a microscopic study to find this pathway now. So what are the source books? Most of the remedies come from the only authentic clinical source books. Either it's Allen's, Clark, N.M. Chaudhary, or Boric, or Dr. Fatak, even Farrington and Julian's. First, I'm not going into the detail of the physiology of thyroid, but in short, let us understand how thyroid gland works. So the hypothalamus makes TRH, that is thyrotropin releasing hormone, that stimulates the anterior pituitary, that makes the TSH, which stimulates the thyroid gland, and the hormonal cycle continues. This is very much in detail. When I do the course, it goes slightly more, but for our clinical understanding for today's topic, just understand this much. Common signs and symptoms, we all know about hypothyroidism and hyperthyroidism. You have hair loss, inability to think clearly, goiter, reduced.
ના એટલે તમે લોકો વાત કરો એટલે મેં મારા કાનમાં નાખ્યું કે કોઈ ડિસ્ટર્બ ના થાય.
Okay,
Sorry, sir. Sorry, sir.
Hair loss, puffiness of the body, and same in hyperthyroidism, you have weight loss occurring and tremors and sleep disturbances, metabolic problems. So we all know about this very much in detail, what happens in hypo and hyperthyroidism. Mostly we get diagnosed cases, or now we as homeopaths or doctors are so well versed in diagnosing hypo and hypothyroidism that now thinking will be beyond this. What to do? First is complete your investigations properly. Just don't go by the diagnosis which the patient comes with. So what are diagnostic things that are available? This is especially for the juniors. You do the TSH levels, then the T4, free T4 levels, free T3 levels, anti-TPH, anti-TPO. Ultrasound of thyroid is also very important. Many times you need to do an MRI if you are suspecting a tumor. Then the radioisotope scans. These are all for in suspected tumor cases. Lab investigations with concern in females, always do the USG full abdomen, serum estrogen levels and insulin levels, because in most of the cases, they are clubbed with PCOS and obesity, where there is a problem with the insulin levels. This is the chart which is given in the book. So we are not going to discuss about this, how to identify what rise and what change indicates what. These are the investigations which you should do to find what type of nodule it is, benign or cancerous. This is another important thing that comes in our practice, that is Hashimoto's. What happens in Hashimoto's is there could be a goiter formation, which is the swelling of the neck. It is an autoimmune disorder, and you will see the goiter growing. There are so many symptoms of Hashimoto's, but you have to investigate and then only treat. And it takes long time for the patient to have reversal. So don't tell that after starting that you will be all right within few months. Okay, these are some signs and symptoms which are given in the books: weight gain, fatigue, paleness and puffiness of face, joint and muscle pains, constipation, infertility, another important association with thyroid disorders, thinning of hairs, irregular or heavy menstrual periods. The size of the goiter is generally used to classify the type of goiter. If grade 0, there are so many cases of goiter where there is no swelling present. That is grade 0. Grade 1 is neck thickening is there and it is slightly palpable. It moves while swallowing. That is the first time when the patient spots it and comes to you. Grade 2, where it is obviously visible, and there are still more grades where the grade 4, where it is very obviously visible, causing pressure effects. What are the types of Hashimoto's? One is Hashimoto's thyroiditis, then de Quervain's thyroiditis, which is infective, and silent thyroiditis, which is called the Graves' disease. And these are the symptoms of Graves' disease, where you have excessive sweating, weight loss, nervousness, emotional instability, tremors. Exophthalmos is one thing on which you catch the disease generally, intolerance to heat, arrhythmias. Arrhythmias are something that you are going to see in very frequently. So this is one time that you should always ask the patient to get himself investigated. Sometimes patients presenting with recurrent diarrheas can also have thyroid disorders. So these are some of the investigations. I think most of them should be knowing about this, but all those who are new to it can just take a snap from the screen. So let's go to the approach. How to use the newer approach in our practice. I want you to listen to this carefully. So the newer approach, as I told you, is an extension of the old, which encompasses the way to access the lesser known remedies. You know what happened once when I was reading thyroid because of one stuck case, and I started reading the literature. I found that there are so many small remedies which are mentioned in the Materia Medica. And then when I was searching in the repertory, I couldn't find them. So they did not come into my prescription so often. So I decided now let's find all those remedies mentioned by our teachers which have an action on this thyroid gland. And when I started reading most of the literature, I found there are around 55 to 60 remedies which have their action on the thyroid gland, which has been documented, but they are not present in the repertory or not mentioned so strongly in the Materia Medica and so commonly used in our practice, but they give excellent results. So now this whole process, this whole case taking method is to churn out those remedies. And I'll tell you, after you go through this process, you will be able to find these remedies so you don't miss them. And they are related to different pathological conditions. They are related to investigations. See, my friends, we used to never correlate the investigations and the prescriptions in homeopathy, because there are so many conditions which change with the investigations. We don't correlate the investigations, the physiology, and we don't even correlate different conditions that are existing along with thyroid. Because as we have concomitant symptoms in homeopathy, what I have found that we have concomitant systems in homeopathy, which are peculiar and indications to the remedies. And they are so hardcore indications that if you prescribe on them, there is hardly any chance that it will fail, because it is another peculiar indication of the person within. Secondly, it is not open to discussion because it is the fact and it is the peculiarity of the person. So from the new approach, what I felt was most important was that we need a system. See, we always say, and I always believed for a longer time, that homeopathy is an art. And since it is an art, we see that very few people have got this knack of prescribing remedies in a beautiful way. But if we have to make homeopathy successful, then we have to make into a system that you all are already doing in so many ways. When I saw your curriculum today, we have to make a system. We have to make a kind of pathway to find these remedies so that anybody and everybody who takes up should be able to practice it. So this approach is a systematic approach where you will be able to come to these lesser known remedies. And those remedies are not going to be specific remedies. They are going to be remedies which will indicate as a pathological simillimum in that person, because it will have the thyroid pathology and an associated symptoms which will indicate as a person as a whole. Secondly, it is easily adaptable. It will not stay as a person practicing it and his domain. It can be adaptable and anybody can use this. And this is the most important thing in homeopathy that we need to do, is it should be easily adaptable and everybody who are using it should be able to come to the near to same simillimum. So what was the effect that I had after using this was quick reversals. Earlier, we used to wait for years together for having any change. Now what we see is, we see very quick reversals and we can tell the patient that you are going to be all right. Now we can manage a range of thyroid conditions. Now we have a better understanding of the pathology. Third is, if there are any pathological condition that is associated with it, which would earlier scare us that we don't know what may happen to the adjoining pathology which is there with the thyroid condition. Now no longer it is, because we are using the remedies which are known to work in the adjoining pathology also. Secondly, they come from the authors who have tested it the worst. And that's the reason the results have changed in the practice like anything. And this is what I would like to share with you today. So earlier, and to start, you have to not change the way you're practicing. Whoever you're following as a way of case-taking method or as a way of practice, please do the same case-taking the way you are doing. So you, as I told earlier, you come to the constitutional remedy by whichever method, let it be a sensation method, predictive method, or Seiger's method, whatever. You come to the individual remedy first. But before prescribing, you have to go through this new method which I'm telling you. In many cases, as I told you, there are small remedies with the action on the gland do not reflect. And this method is now here, which is devised after years to treat the ailment without missing these smaller remedies. So that is the advantage now, that you can see all these remedies together, decide if they are going to have a go at your case, or you can use it when indicated. So in this addition, modified case taking, which is a systematic process of coming to the smallest possible remedies based on physiological and pathological signs and symptoms, we have a kind of a questionnaire. Now this questionnaire is what you need to understand. This questionnaire is a specific questionnaire where you have to only answer yes and no. The whole idea of making this questionnaire is to make a pathway to these small remedies so that they become a part in your prescription if they are present. So on one side, you will have the questions, and on the other side, you will have a blank column. We have to just tick if that thing is present or not. Okay. So that is what I call as the thyroid case paper. And I'm just giving an excerpt of that case paper, how it is. See, in regards to chief complaint, for example, on the left-hand side, it is written that are you treating a case of hypothyroidism or hyperthyroidism? Then you have the onset. Now, how this question paper was made is what I'm going to explain to you. So, in every case, you have to ask about the onset. Now, if you have to understand the onset, we have been taking many causes, mostly emotional. But we did not know that there are some causes which lead to thyroid problem, and they can be as abstract as an injury. Okay. And this is what has been mentioned in the Materia Medica, that if you have a thyroid problem after an injury, the remedy is conaium. After emotional grief, you have amyl nitrosum and chlorella. In my practice earlier, I used to be very happy in prescribing Natramuse and Ignatius. Maybe I had results also, but I never knew at that time that amyl nitrosum or chlorellum had an immense action on thyroid when it came up after the grief. Similarly, if there is a physiological cause, we have an indicated sarcode. At puberty, we were so happy prescribing our pulsatlas, but we have remedies like calcarea iodatum and thyroidinum, which help in puberty and pregnancy also. So they are not specifics, but they are entry points. So after your case taking is done, you can always ponder over this remedy and see if there is anything about this remedy which we have missed in the case. Now, at birth, if anybody has thyroid problems since birth, since puberty, since menopause, post-hysterectomy, and suppression of menses, and if there is an use of any OC pills. So why did I mention only these many as causes? The whole reason is because these are the only causes which have been mentioned in our Materia Medica which have any relation to thyroid problem by these teachers. Apart from that, that can get included in our constitutional remedy. But if you have any of these causes, then you have specific homeopathic remedies which have an action on thyroid gland. And we are missing it that way. Location or the manifestation. Do we have a mixed edema or a normal generalized edema? It is on what part of the throat? Is it a right-sided goiter or a left-sided goiter? Do you have any symptoms of swallowing associated with it? Okay, so you have remedies on locations also. Like, for example, if the thyroid swelling is encompassing the chin and the throat, you have a remedy as effective as spongia, which we never thought about it. But spongia is very effective if you have the gland swelling which is covering from the chin to the throat. Then the pace of the disease. The pace of the disease also indicates a remedy. Then the consistency. If the gland is just enlarged and hard, you have bromium, iodum, natrum carb. Okay. If it is endurated, you have bromium and iodatums coming up. If it is knotty, it's calcarea iode. So now if you are following the earlier question which I have told you, if there is a lady with a goiter since puberty or since pregnancy, and it has a knotty appearance, then it has a double confirmation of it being calcarea iodatum. Earlier, if the patient was calcarea carb, we would prescribe calcarea carb because it was a constitution. But now I would prescribe calcarea iode instead of calcarea carb if I find a knotty appearance and if I find that the patient is having since puberty. So now the prescription becomes more finer, more specific, and more indicated because it is more a pathology that is covered now. So basically this case paper, actually it's a big case paper of around 50 questions or so. It is like a Google map. It will navigate you through the whole phase of the patient's life, his physiology, his pathology, and then find out all those remedies that have a correlation of thyroid along with the existing symptoms which are missing. So you just go on ticking all those questions in the questionnaire. At the end, you will come to a kind of positive answers. So these positive answers which you get generally in any case are not more than 3 or 4. This you need to put it to a new thyroid repertory which I have prepared. Now this thyroid repertory is again unique because it includes all those conditions which are not mentioned in the conventional repertory and have an association with thyroid. So what you do, you take the all positive answer, and we have a search word which I have made as a specific for the electronic repertory. The search word will be goiter. That means I have used for hypothyroidism also goiter and for hyperthyroidism also goiter. With this understanding that we have a remedy which has an action on the gland and not on the pathology. So the search word is goiter. So now what you have to do, you have to put goiter and the associated condition from the case paper. As I told you, this is the way the case paper has been divided. In the same way of LSMC pattern, it has a physiological correlation, pathological correlation, and investigative findings. This is the sample of the case paper that you are seeing on your screen. Again, the past history of which I would like to mention. When you are taking cases and you are seeing past history, we give very less importance to past history in your prescription. But in our Materia Medica, these conditions in the history of the patient's past or even in the family history is very significant in prescription of thyroid. Like for example, if the patient had chickenpox or mumps earlier and develops thyroid disorder afterwards, we have remedies for it. And we are completely missing this in our practice. That is the main reason for relapse. Because we believe that if we treat the constitution, we are going to have the patient coming back to normal always. But what about these disease conditions which have left a kind of a sensitivity which is causing the permanent stimulation of the thyroid gland? For that, we needed these remedies. And these remedies now, it is so easy because only these conditions have any connection with thyroid which are mentioned in our Materia Medica. There is no other 12th or the 13th condition. So we have now scanned all those diseases possible so that you can have only specific disease that you need to ask about and not everything else, because these have effective remedies which are in correlation with the thyroid remedies. How to apply this approach in clinical practice? Now, using the special case paper which I told you as a guide, and the 2 columns that you have, the left-hand side is the questions and the right-hand side is the answers. You have to ask specific questions based on the case paper and obtain informations through examination and investigation. Make a list of the specific positive answers. Rest you can just keep it aside. And repertorize using the thyroid repertory, which is a part of this in case taking process. You will obtain 1 or 2 remedies which cover the thyroid specific condition. Now, once you obtain the remedies, do not again prescribe. Behind after the repertory, we have a thyroid Materia Medica. This Materia Medica, which I have compiled, is a clinical indication of these small remedies mentioned by all these clinical authors, and they are so objective that you are going to find it in your patient. If it is there, you prescribe and you will have results. Not a single symptom that I have written in that part of the Materia Medica is subjective. Most of the symptoms are very objective. So if you see them, they are going to get treated with the remedy. So no longer it is going to be something as a subjective understanding of the remedy or subjective understanding of the patient. If it is there, you use the remedy and the patient is going to have results. So the thyroid materia medica is an amalgamation of my clinical understanding, which I had after using the remedies in my practice and from different books, as I mentioned to you, with PQRS symptoms, which are objective and easily perceptible. No subjective symptoms. The remedy thus obtained will be a thyroid simillimum. Remember, the remedy after you do the case taking process, then you pass through the case paper, then you repertorize. It is going to be a thyroid simillimum. It will have a relation to the original remedy. If you can see the relation to the original remedy, you can prescribe in that way. If you don't see the relation to the original remedy, prescribe the constitutional remedy the way you are doing it. The moment the constitutional remedy doesn't give results, that is the time you can now put this remedy in the practice to see if it is going to complete the cure. So, since it is not a constitutional remedy, since it is a pathological simillimum, we use these remedies in a very low potency. I have found success in 6x and 10x and 12x potencies only. I do not give this remedy in any dynamic potency because it is more a pathological simillimum. Another important understanding that I devised after using it in so many cases is, since the remedy is a pathological simillimum, acting on the pathology, it is very important that it should have the content of the medicine in the remedy that we give. So if your remedy goes beyond 12x, the content of the medicine diminishes. That's the reason I thought of using this remedy, which comes in through the analysis of the case paper, in a lower potency. But listen carefully. If this remedy that comes through the analysis from the thyroid case paper is similar to the constitution, please give in the dynamic potency indicator. Am I clear to you? The potency is going to increase only if it covers the mind and the body together. If it is a pathological simillimum given X potency, you will have excellent results. But if it is a constitutional remedy that has come through this analysis, the specific pathological analysis, the pathological simillimum and the constitutional simillimum, if it is same, give in the dynamic potency of 200, 1M, 10M, whichever is indicated. But if it is not, continue with your constitutional remedy. If the constitutional remedy stops acting, come to the pathological remedy in a 6x potency, give it for some time. That also I'm going to share you afterwards. And then you will see that this reversal occurs very faster. It can be also used as an intercurrent remedy with the deeper remedies that have general and emotional states very much clearly indicated. But if it is, again, I tell you, if it is a constitutional remedy, you can give it individually also. This approach of going into the details of the physiology and using the characteristic particulars to choose the remedy, as well as more pathological simillimum remedies, has changed the practice so much that the results are now quicker and we are no longer dependent on the modern medicine for reversals. You can do it yourself. And this was only possible when we started this systematic approach in case taking. Now, this is just a sample of the clinical repertory which I have made. Here, the search word, as I told you, is goiter, and it represents all thyroid dysfunctions. So before adding any symptom from the case paper, we need to use goiter as a prefix to search in the repertory. Otherwise, the repertory is not going to search for you. All listed signs and symptoms should be searched from the clinical repertory which I have made, because no other book gives you the access to those remedies together. The remedy that has more totality, you have to verify from the literature that is provided about the thyroid of that particular remedy compared from the different clinical books. This is the Thyroid Repertory where you have goiter, and then these are the sub-rubrics. The allergic tendencies, especially in children, craving for salt, desire sweets, diarrhea with. So these are the conditions that are associated with thyroid disorders and having a remedies for it. This is a new repertory that we have made. And this repertory will only analyze thyroid disorders, nothing else. And all the other indicated remedies which are present in other repertories have not been included. We have included only those remedies which are not present in the conventional repertories. So you don't have to mix both the repertorizations together. This has to be repertorized separately. So you come to the pathological simillimum with this, and the constitutional simillimum still stays the same. All this has been compiled in the book that is Conquering Thyroid with Homeopathy. So this book is about how to go through each case of thyroid without missing anything. It will have a case paper. It will have a detailed explanation of how to understand the pathological condition. It will have the explanation of the investigations and their correlation with the patient. It will have the thyroid case paper, it will have the thyroid repertory, and it will have the thyroid materia medica also. So if you go through this book, you will find a complete guide to understand thyroid in terms of our homeopathic materia medica with all possible remedies having their action in thyroid gland, even the smallest possible remedy which has been clinically effective. So let's go to cases. The case of hypothyroidism. A 38-year-old female came to us with hypothyroidism. I will share you those cases. The time is short, otherwise I would have shared you many cases with this, but I am going to show you those cases where how with conventional case taking we had successes, and how there is a relapse, and what we do when the patient has a relapse. So you will understand exactly the birth process of this particular method. She came to me with hypothyroidism, obesity, edema of the whole body, extreme weakness on exertion, dryness of skin, body ache, and palpitation and anxiety. These were her presenting symptoms. At that time, her TSH we did, and it had increased to 6.20. So we went into her history. She was a Buddhist monk living in the Buddhist hermitage since her divorce. There was a story to it. She had got married into this particular household with a very dominating husband and a typical mother-in-law. This mother-in-law was a tyrant for her. They used to have verbal and physical abuses many times in her life, in this first few years of her marriage. And it so happened one day, when she was pregnant, there was a huge physical abuse. And because of the physical abuse, she aborted. The conception also occurred in a similar kind of situation. And in the conception also a similar situation occurred. And she aborted, and after that she failed to conceive. Since she failed to conceive, the in-laws started troubling her more, and then she decided to get divorced. Because after that also she had many abortions. With this strong grief in her mind, she goes to this hermitage and she's praying. That's the way her life was. But this trauma was so live in her. She couldn't wash it out. During this whole period when she was physically abused and harassed, she only silently cried. She never had any way to express because most of the time she used to spend in meditation. Since we all know, we understand sensation method. That's what I understand now, that you should be understanding it. I went to her situation and asked her, tell me the experience of this stressful situation. And the expression was a typical Logenesis shock. So with this sensitivity, with this amount of grief, such a huge amount of sorrow, and the typical explanation of Logenesis shock, and her higher sensitivity to tobacco, extremely chilly patient, I guess we all know the remedy. Grief, which was strong, she takes the path of meditation. These were the rubrics that were considered. Okay. And the remedy that came out was Ignatia. So far, so good. We prescribed Ignatia in 1M, 10M, then later in LM potency, and patient was perfectly better. She did not have any problems thereafter. For another 2 or 3 years, she was better. In 2018, that is around 2 years around, she came up with the similar symptoms. Then she had dullness, hair fall, weakness, weight gain, again the pitting edema, sleepiness, weakness and pain in the legs, again slightly better by warm bathing. So since we knew that she had a past history and so obvious symptoms, we investigated and we found that her TS was 53. Such a huge relapse it was. The T3 was 2.03, the T4 was 0.43, and anti-TPO was 104. Now at this point, we had already prescribed her Ignatia. There was no change. Because when we did a retake also, the story still remained the same. She had the same grief. The grief won't change. She had the same sensitivity. So we prescribed Ignatia, but there was no much change. And that was the time when we subjected her to the case paper. Now, what was a difference here now when we subjected her to the case paper is that we could now relate that this problem started during her menopause. This was the time when she was having her menopause. She had missed her menses. Then there was something else that we found is that there was a past history of tuberculosis in the family. Now, my dear friends, this was something that I never took into consideration at the initial time because that was the time it was a perfect case of Ignatia and we also saw a good result with Ignatia. But when we scanned her through the case paper, we found that there are two small things which have a relation to thyroid, but are not explored in our conventional way. I took that into consideration. Let's see how we can handle this now with these two past histories of the past. If you remember earlier, when we were in our times in the college, they used to say, if a patient of recurrent URDI problems doesn't respond, you have to use tuberculinum as an intercurrent remedy. Why? Because we all have a tubercular sensitivity. That means there is some kind of sensitivity which keeps these diseases within us. So it can be an emotional trauma, or it can be any disease that has been prevalent in your body. How are you sure that every time you do a case, we are taking care of these smaller details which can trigger the disease process? Now we have a method to know it. So after evaluating from the above case paper, following features were found in relation to the pathology. One was goiter and a past history of tuberculosis. So when you put it through the repertory, the thyroid repertory, the remedy that comes up is Drosera. I had never prescribed Drosera for thyroid-related disorders. Never earlier. So we gave a dose of Drosera 1M. One dose. If you open reference work or Vermeulen, you see exophthalmic goiter and tuberculosis in family. It is written in one line in Drosera. That means if anybody in the family has a history of tuberculosis, and if any of the offsprings develop goiter or thyroid related disorders, you can use Drosera. So after 1 month, we took up the another one, goiter with menopause and goiter with grief. So the remedy that came up was ferrum iodatum. Now, ferrum iodatum was not a constitutional medicine. It was more a pathological similimum. So prescribed in 6x potency every day for 2 weeks, once a day, then nothing for 2 weeks, then again repeat for another 14 days, once a day for another 15 days, then nothing for 15 days, intermittently for 3 months. After repeating it for 3 months, we did the report and the TSH just immediately bounced back to 3.07. This was never the case before. The patient was not on any thyroid medicines, of course, allopathically. And this immediate reversal was something which now confirmed the role of these smaller remedies depending on the pathological correlations. And if you, this is a study of the chart which was given by the pathological laboratory. It was 6.02. Then this is after Ignatia, which comes to 3.8. Then it springs up during menopause and again comes back to 2.45. This is the way the patient progressed. So what was the learning point? 2016, when the patient came to me, it was a well-versed case of Ignatia and remained asymptomatic after Ignatia till 2018. In 2018, there was a recurrence. The conventional case taking revealed Ignatia, but the repetition of Ignatia did not yield any results. And on scanning through the paper, we found two important things that we missed in the earlier case taking. That was the past history of tuberculosis and the physiological change of climaxes and the effect on thyroid. After taking that into consideration, one is the past history and the change in phase of life. There was a dramatic change in the patient. So what is the conclusion? That you may have different states in an individual. One is the constitutional state and other is the state which is present due to different insults that we have had in the past. It can be an insult after the disease, or it can be some miasmatic influence, or it can be some phase of life that influences us. And for that, we have homeopathic pathological similimums mentioned so well and so nicely that they are very effective in practice. This is the change that happened after using this approach. And now onwards, it is very difficult that we miss something when you are prescribing in a case of thyroid. Now, again to say, the constitutional remedy still remains Ignatia. She doesn't need any other remedy in any other problems. She will still need Ignatia as a constitutional remedy. But whenever there is a thyroid-related disorder, I will always scan through the case paper to see if there's anything coming up which is missed by Ignatia in its sphere of action. So this is one case. Coming to the next case, this was a case of hypothyroidism with anxiety neurosis. A 48-year-old menopausal lady came to me basically with severe anxiety and palpitations. She was so anxious that even if she had to cross a street, she needed somebody to take her across. Otherwise, she always felt that maybe some car may come and she will have an accident. Walking in crowd was very difficult. Somebody had to hold her hand when she had to walk in the crowd. Whenever she had palpitations, she complained of extreme fear of death. That this moment I'll die. But this is the time when the palpitation has increased. I'll have heart attack and I will die. Her body trembled with palpitations. All her symptoms were exaggerated by any stressful condition or any bad news. Very typical. If she had any bad news, immediately she would go into that frenzy and the panic and have palpitations. She started having weight gain since menopause. So when I asked her, tell me the experience of these situations in panic, and she gave me a beautiful ranunculus sensation. I am not discussing much about the constitutional remedies that I am prescribing because today's lecture is not about the constitutional remedies. We all consider that you all know how to come to the constitutional remedy. This is about the newer approach that we use in thyroid. So when I talk about how I came to ranunculus shock, there are many situations that I have explored, and then I come to the ranunculus shock. On investigations, the thyroid TSH was 17.36. And none of these patients are on any anti-thyroid medicines of allopathy or modern medicine. So what were the pointers to the remedy? Anxiety, climatic period during, anxiety crowding, anxiety walking while, fear death of heart symptoms during, fear palpitations, fear walking across a busy street, trembling palpitations with, and every fright aggravates. So we all know the remedy, aconite. So we gave aconite 1 mg, 10 mg, 2 doses intermittently for the period of 2 months. Follow up, fear reduced, walking in the street better, palpitation reduced, sleep reduced, but her weight remained the same. She developed a craving for sweets also. So basically, now what we do is when a patient is for follow-up, you scan the patient now for the constitutional symptoms and the symptoms of the thyroid also. I want to add to this. This is very important that you know, but we are short of time, so please understand carefully. In endocrinal disorders, you have a constitution and an overlapping constitution of the endocrine gland or the endocrine disorder that you are having. So you have a constitution which gets overlapped with the constitution of the endocrine problem. So you will have a totality of the constitution and it will have an overlap of this symptomatology created by the constitution. So many times the laziness, the dullness, that is not the part of the original constitution, but it is the symptoms of the overlapping constitution created by the endocrine disorder. So you need to look at the constitution and even the endocrine symptoms separately. This is one new find that I am now using not only in thyroid, but in cases of PCOS also. In a lot of cases of PCOS, you have a hormonal overlap, like you see a lot of testosteronic symptoms. You see progesteronic symptoms, and you give homeopathic similimum, and it does not work well that way. For example, craving for sweets before menses, we always used to use sulfur or magnesium carbonicum, thinking that it is more a homeopathic symptom, but it is basically a progesteronic symptom. If you study through the books of endocrinology, you will see that the endocrines, progesterone exhibits craving for sweets, and we have been prescribing homeopathic remedies. So we have to understand that we need to prescribe on the indications of sarcodes also. So we evaluated the patient from this case paper again. So we have weight gain, anxiety neurosis, and this was the TSH, dryness of skin. And the points we had for repertory was the allergic tendencies that she had, the desire for sweets, and tendency for obesity along with thyroid. So if this along with thyroid was repertorized, of course, the affections and nervous tremblings, the remedy that came up was thyroidinum. Now, the thyroidinum remedy, which we empirically prescribe, now comes with different indications which are present in the patient and becomes more justified. She was now given thyroidinum 6x intermittently and aconite only on indications for 3 months. And within 3 months, the TSH level came to 5.34. This quick reversals earlier did not happen. Now, what was the learning in this case? Patient, though constitutionally aconite, had an overlapping constitution which was created by the menopause and the thyroid dysfunction. So the patient is still an aconite. Today she is better for now many years. She is still an aconite patient only. But the overlap that was created by the thyroid and the menopausal phase has now been eradicated. So on conventional analysis, the remedy that came up was aconite, which helped the patient to get her emotional symptoms out. But it was not covering thyroid in its sphere of action. Though ideally it should have, but it was not covering because the symptoms of the thyroid remained the same. And that is the time you employ the remedy that you do through the specialized case-taking process. The residual thyroid symptoms, which could be deciphered easily on the follow-up, needed a pathological simillimum. And the remedy that was used was thyroidinum. Now, to all my friends, I would like to now share something about thyroidinum, which can be a day-to-day remedy in thyroid practice. But what I have found clinically is what I'm going to share with you. Especially the juniors, they can see this as very good addition in their clinical practice if they use it with these indications. This is one of the very commonly used remedy in thyroid disorders, but many times abused also. But I'll tell you, if you can use it the way I tell you now, it will be very effective clinically. Sheetal Kabre, I think your camera and
scribbling.
Somebody scribbling. That's not good.
Yeah. Sir, if you could stop sharing and start sharing again, this would go away.
Actually, we come to know the names of people who are doing it. So please be cautious. Dr. Sheetal, you can put the camera off. Thank you. So understanding this remedy is of vital importance in treating thyroid disorders, especially in women of different endocrinal disorders. Clinical application. Understand this very carefully. Women in their lifetime go through 4 hormonal phases. One is puberty. Second is pregnancy. Third is lactation. And the fourth is menopause. And thyroid gland has a very important role in governing this. Any failure to cope up during this phase, like never been well since puberty, never been well since pregnancy, never been well since lactation or menopause, one of the gland that is responsible is thyroid. Please remember this. We have remedies for it, but if your remedies fail, then remember that there is an endocrine process that is governing this phase of life. And if you have the indications for them, please use this remedy. So hypothyroidism in puberty. In puberty, if you have weight gain, slow growth, being shorter in height, looking younger than age, slow breast development, heavy or irregular menstrual periods, increased testicular size in boys, delayed puberty, or dry skin, brittle hairs and nails, constipation, puffiness of face, joint and muscle pains. These are some of the endocrine symptoms of puberty. If these are not handled by your constitutional remedy, give an intercurrent dose of thyroidinum, because these are the symptoms of thyroid gland about to start its function and not coordinated properly. So you have so many girls who will tell you that since puberty, I have started putting on weight. My height has not grown since puberty. The breast development has not been well since the time puberty, and never grew after that. So when you give a constitutional remedy and if it is not doing well, please consider thyroidinum in case of puberty with these following symptoms. Postpartum thyroiditis, very, very important thing that we handle in clinical practice. After delivery, if there is an unexplained weight loss, increased sensitivity to heat, fatigue, tremor, and insomnia, which are so commonly expressed by patients to us, and we give remedies depending on the symptoms or finding a similimum here, please give your similimum, but think of giving a dose of thyroidinum here, because it is a thyroid gland that is still responsible for postpartum thyroiditis, and your constitutional remedy will do well, but you give one dose of this and you will see a dramatic change in the patient. Hypothyroidism and lactation, especially during lactation where the mother experiences lack of energy, constipation, dry skin, weight gain, depression, always bank on thyroidinum. This will be one of the very important remedies to start and then prescribe with your constitutional remedy. Now, menopause and hypothyroidism. Please understand this very carefully. In menopause, we have hot flushes and night sweats. But if there is a hypothyroidism in menopause, you will have increased sensitivity to cold. If there is irregularities and in the lower urinary tract, there is some kind of urinary infections. This is very common in menopause. When there is hypothyroidism that is coupled with menopause, you will have high blood lipid levels and triglyceride levels. You have disturbed sleep, you have slow heart rate in hypothyroidism, you have poor memory, increase in body fat. Lot of women will tell you that since menopause, I have started putting on weight. I have had thinning of hairs, depression, hoarseness of voice, weakness in the muscles. These are the women who need a dose of thyroidinum. So during menopause, if you see these kind of symptoms and they are not covered by your constitutional remedy, or your constitutional remedy after giving doesn't relieve the patient of these symptoms, you understand it is the thyroid that is being active there, and we have something which is called as subclinical hypothyroidism. My dear young friends, we have many cases of subclinical hypothyroidism which do not come on clinical investigations. And these are the symptoms of those. So do not use it for repertorization and give a remedy. Or even if you use it and these symptoms do not change, then please understand there is some hypoactive or a hyperactive thyroid gland, and you need a dose of thyroidinum. For clinical understanding, we need to see this for expression during the 4 phases. On CVS, means a lot of females will tell you that during any of these 4 phases, increased pulse rate, tachycardia and hypertension that developed at any of these 4 phases. Blame it on thyroid. So you will require a dose of thyroidinum. So apart from the well-proved indications that we have in our Materia Medica, these are clinical indications that will help you in many cases. If you see flabbiness of the muscles, which is very common during menopause, lot of ladies will tell you about the laxity of the muscles, lot of weakness, and you have given your CPRs and lacases and so many remedies, and this doesn't go. That is a time when you can use thyroidinum. Premenstrual syndrome, where there is a lot of irritability, dysmenorrhea, breast tenderness, and your constitutional remedy is not holding good, It is always thyroidinum. You read the physiology of thyroid because this is one gland that gets activated during puberty. So you develop a constitution also, but it is this gland which is the main gland which gets into action during puberty. And if there is a slight dysfunction, though not seen on investigation, this is something subclinical. You need to prescribe 1 dose of thyroidinum and it will help you in your clinical practice a lot. Increased sexuality or loss of libido in any phases. Any phase which leads to loss of libido or increased sexuality, you always think of giving a dose of thyroidinum. Obesity that has started after any of these 4 phases. Whatever may be your remedy, please think of this remedy, thyroidinum. Nodules of goiter or breast tumors during these phases. See, we have so many girls coming to us of pubertal fibroadenomas. I guess the senior practitioners will agree to me that a lot of girls in puberty come to us with fibroadenoma. At that time also, with your indicated remedy, please think of giving a dose of thyroidinum. Weakness, anemia, puffiness, edema, which we call as idiopathic. Lot of females during menopause, they come to us with this kind of symptoms. You do the thyroid report, it is normal, but believe me, this is called subclinical hypothyroidism. And this phase also you have to prescribe thyroidinum to see good clinical results. Follow-up remedies. Many remedies which we have prescribed, calcaria and graphitis, especially with obesity and debility, and they are not doing well, think of giving thyroidinum. Sepia, which you have prescribed on the basis of menopausal symptoms, and it is not completing the cure, give a dose of thyroidinum and you will see a good completion of it. Pulsatilla, where there is changeability, edema, and problems related to puberty, where your pulsatilla is not able to cure and complete the case, give a dose of thyroidinum and you will see pulsatilla doing wonders. This, I guess, is one thing that you should never omit. You have cases of urticaria, you have cases of different allergies, which have responded to your constitutional remedy to around 80%, and the last 10% is not going, then always think of giving a dose of thyroidinum and you will see that case, the sarcode completes the cure. Dwindling of breast and after pregnancy or at menopause is another good indication, which is very clinical to give this remedy thyroidinum. It is also indicated with PCOS. PCOS is another excellent topic which has to be discussed with thyroid. And if you can use this remedy, thyroidinum, with these kind of indications, you will have fantastic results. Whatever I have discussed is only clinical, which I have found in my practice. About thyroidinum, there is a huge literature and everything that is given in Materia Medica. But this, what I have told you, is clinically, if verified, you can apply it and see it for yourself and you'll have excellent results with this. Emotional changes during these phases like irritability, anger, pregnancy, during pregnancy or during menopause, think of thyroidinum. Of course, you think of the homeopathic remedy first, but if it doesn't act, think of thyroidinum. Now, this is something which will help you a lot and it has helped me in my practice also a lot. In a mother who had hypertension or diabetes during pregnancy or suffer from any endocrine disorders or symptoms during pregnancy, and if you see a IUGR, that is intrauterine growth retardation, thyroidinum is one remedy that will come to your rescue. Because anything related to growth, anything related to the retardation, especially during the developmental phase, you should think of thyroidinum. And this I have used and verified so many times in my practice. Another thing which I would like to tell you is, if you have a child, especially of autism or developmental disorders, and if the mother has a history of thyroid disorder during pregnancy or before that, then please start this child on a dose of thyroidinum first and then go to your constitutional remedy. You will see a dramatic result in your practice. Because it is thyroid that was dysfunctional, caused him to inherit that particular state or the genetic predisposition, which is now responsible for his particular situation. You will understand this if you understand miasmatic understanding from Burnett or from the chronic disease. And then you can now map up with the newer approaches in endocrinology. This will really help you in getting excellent results very fast compared to your conventional ways. Other important clinical verifications, as I told you, goiter in newborn. This is again with the same understanding which I have explained you. If a newborn child is having goiter, it has to have some genetic or some miasmatic background. And in this case, you always use thyroidinum as an indicated remedy first. Craving for sweets with weakness is one of the very important indications of thyroidinum, as I told, of progesterone in premenstrual phases. Sensation of faintness, weakness after an acute disease. If your acid for selenium, these remedies are not acting, please give a dose of thyroidinum and you'll see the same remedies doing excellent after giving a dose of thyroidinum. So all you want to know about this, as I told you, is compiled in this book, Conquering Thyroid with Homeopathy. And if anybody wants to order it, this is something that you can copy. You can get it online by booking on the above address or writing a mail to onlinedhp.com or dhp.amt@gmail.com, or you can WhatsApp and they will tell you about how to get this book. Now, something which I would like to add today is what I'm doing next as a treat to y'all maybe. Cases of PCOD and infertility. Now, in PCOD also, I have tried to make a kind of approach, which I may not go in very much detail, but I'm just going to give you a glimpse of how I work in cases of PCOS, especially which are curbed with infertility together or only with PCOS. A 27-year-old female with PCOS came to me with complaints of basically infertility. She had irregular menses. She had dysmenorrhea since menarche, and it was a case of primary infertility. Her presenting symptoms were irregular menses, infertility, dysmenorrhea, dryness of hairs, and hair fall. She had a history of conjunctivitis and febrile convulsions. Her sister also had PCOS and she was also under treatment for infertility. Father was a known case of diabetes mellitus. Her physical generals were as follows. She loved meat, but that used to aggravate her. She desired spices. Fasting is something that she couldn't tolerate, could cause her headache and eructations. She had perspiration on the scalp, nose, and upper lip and the chin. The mental state was, she was a very mild woman, extremely sensitive to reactions of people. And after she got married, things changed drastically for her. As usual, she had a dominant mother-in-law because they are very essential to create constitutions, isn't it? So she was very sensitive to her reprimands. And very slight argument here and there would make her cry. Used to get very hurt very easily. So as I went into the depth, I asked her, how does this come to an experience? It was another beautiful case of ranunculosis sensation. So clubbing the sensation with the following peculiars, the remedy that came up was pulsatilla. Menstruation irregular at puberty, fasting aggravates, and all the physical generals. And the sensation of ranunculosis, we came to the remedy pulsatilla. So her individual remedy was pulsatilla. We gave her 202 doses. On investigations, we found that she has PCOS. Okay. and she had a raised testosterone levels of 58.65. Her AMH was 9.39. So there is a new approach which I have made in PCOS, which is something very similar. I'll just tell you in brief about it. In this approach too, I have studied all the remedies which have ovarian cyst in its domain and tried to understand the correlation of the ovarian cyst and these remedies and the pathology existing in it. So here too, we found that there are many remedies which have an action on the ovarian cyst and are very effective in reversing it or regularizing the hormonal pattern. But again, they do not find the way in the Materia Medica because they are pathological concomitant remedies. They are not symptoms. See, our Materia Medica is full of symptoms which are converted into rubrics. But we do not have systems that are existing together. And that is my whole purview of research today in many, many different pathological conditions. That is what I am trying to do now, is to see what are the core different pathological conditions that come into coexistence, which have been mentioned in our Materia Medica and which have been only to the few great teachers who have understood it. Now I'm trying to compile them together to see if they can be effective in clinical prescribing. And this I did in thyroid, I did in PCOS, this I have done in rheumatology and even in uremia, and I found good results when I used different clinical conditions as concomitants in practice. So the USP of this approach is you can see the constitutional remedy clearly. You will see the anti-miasmatic clearly. You will see the homeopathic hormonal simillimum clearly. Again, you will have a PCOS questionnaire. You will have the repertory and the lesser known remedies with their Materia Medica. The need for the approach, after microscopically studying different clinical Materia Medicas, I inferred that many remedies for clinical conditions associated with ovarian cyst, as I told you, did not find a way in the repertory. And we need a way to culling out these remedies. It also helps us to find pathological simillimum and the corresponding SAR code indicated in the given case. There's a questionnaire, which we will not go in detail, but this is very similar to the questionnaire which we have in our thyroid case paper. On the right-hand side will be questions, and on the left-hand side, you will have the associated conditions with the ovarian cyst, which have their mention in the Materia Medica. The positive findings of the question are to be repertorized from the PCOS repertory, which we have. And the remedy that obtained is, again, you have to read from the Materia Medica of the following corresponding ovarian cyst remedy, which is there in the Materia Medica. If the remedy is same, then you have to see that what is its relation to the constitutional remedy. And if it is not a constitutional remedy, prescribe in lower potency. And if it is a constitutional remedy, prescribe in a higher potency. So the PCOS questionnaire was derived by studying different associated conditions and the hormonal correlations associated with the ovarian cyst from different Materia Medicas. This is the source of literature from where I have collected these pathological conditions as concomitants. Dr. Allen, Dr. Fatak, Dr. Borick, Dr. Clark, Dr. Farrington, Dr. N.M. Chaudhary, Kent, Julian. Okay. So how to use the PCOS repertory? Here the search word is ovarian cyst. Like earlier you have the search word goiter. We have a search word ovarian cyst here. And again, you have to list down the positive conditions if you find in the patient by ticking it yes. So after we scanned this lady from the PCOS questionnaire and the PCOS repertory, we got the following rubrics. Ovarian cyst, menses bright and dark. Ovarian cyst, menses clotting. Ovarian cyst, menses scanty. Ovarian cyst, menses suppressed. Now see, we were taking these rubrics independently. We never took it as a part of the pathology also. When I take it as a part of pathology, I again see pulsatilla coming up. Can you now imagine that the remedy, which is the constitutional remedy here, equates even pathologically? And when you find a remedy equating at the level of pathology also, from different great authors, and the constitutional remedy from your system, whichever system you practice, the amount of confidence that you will have in prescribing. So the remedy becomes more justified. So after repertorizing from the PCOS repertory also, the remedy that came was pulsatilla. So it is a constitutional as well as the pathological simile. So she was given pulsatilla 202 doses and later 1 m 2 doses at interval of few months. Now there is a new concept that I have developed in the follow-up of PCOS. This is very important, and I guess you should focus on this as an attention. What to observe in follow-ups in especially PCOS is, first is the symptoms of the constitution. Do you still see the pulsatilla within? Then you look at the generalities, and then you should look at the predominant hormonal state through a special hormonal chart that I'm going to share with you. Along with it, you need to look at the concomitants, which are specially premenstrual, postmenstrual, or during menstrual symptoms. Now, this hormonal state thing, which I'm going to now show you, is very important in deciphering the patient needs the constitutional remedy in the follow-up or needs the corresponding sarcode. If you see a hormonal symptoms predominating the constitutional symptoms, I am repeating again, if you see the hormonal symptoms preceding the constitutional symptoms, then we need to prescribe a sarcode. I am basically now changing the way we prescribe sarcode than what we were doing conventionally. If the constitutional symptoms predominate, then you prescribe the constitutional remedy or the corresponding pathological remedy. After that, after 1 month, when she came for a follow-up, her menses appeared. There was a prolonged flow. She had tenderness of breast, nausea, and diarrhea during menses. Now, what I do is scan through the hormonal chart that is prepared from the book of endocrinology. I want you to focus on this understanding. The chart that is now flashed on your screen are the symptoms of progesterone, estrogen, and testosterone as symptoms from the books of endocrinology. They are not the symptoms from our Materia Medica. So, if a patient comes to you in a progesteronic phase, these are the symptoms that you are going to see: bloating of abdomen, tenderness of breast, puffiness of hands, frequent miscarriages, menopausal disorders, craving for sweets. So either of these symptoms are what you're going to see in progesterone. In estrogen, you may see atrophic vaginitis, tenderness, menorrhagia, prolonged and heavy menses, and nausea, diarrhea. In testosterone, you may see rapidly changing moods, quick and impulsive person, insomnia and anxiety, hypertension. So you see these symptoms are no longer symptoms of the constitution, but they are the symptoms of the predominant hormone. And earlier, we were prescribing homeopathic remedies for it. Now what I do with this chart, I will now see which is predominating. Whatever predominates is the indicated sarcode that I need to give in this patient. So if the hormonal state predominates, prescribe the sarcode, and the hormonal state predominance will come from this chart. It will not come from the understanding of the provings. This is the things which is from the symptoms of endocrinology, which has been prescribed by the used by the endocrinologist. So this becomes more specific, more objective. So that is what was the new thing that I have now started using. And by scanning through, we got to the remedy estrogen. After 2 months, emotional, weeping tendencies, better in open air, craving for spices and meat, fasting aggravates, Again, pulsatilla, we gave a higher dose of pulsatilla. After 2 months, again scanning the patient through the hormonal chart, the predominant state was the hormone, and same estrogen comes up. We gave estrogen 30 daily night for 15 days. She developed a strong mental tendency due to a family situation. 10 m 2 doses, 50 m 2 doses were given. After 3 months, she comes up with the following symptoms: scanty menses, bloating of abdomen, craving for sweets. So we scan her again through the same case paper chart. The remedy that was indicated was progesterone. So progesterone was given for 15 days. See, remember my friends, in every woman, there is a upsurge of different hormones going on. And we do not follow that. We only follow symptoms. By doing this, I am following the exact hormonal symptoms that are coming because of the hormonal upset. And that has given considerable different results in my practice. After progesterone, menses are normal. And the surprise was the testosterone, which had gone up, has come back to normal. So I prescribed her constitutional remedy whenever indicated. I prescribed her testosterone. I prescribed her the hormone whenever indicated. It was never done empirically. It was done only on typical clinical indications that I had based on the symptoms from the books of endocrinology. And we could see immediate reversal in the hormonal readings after the investigations. So now all hormones are normal. Menses are regular. Emotionally, patient is stable. USG shows immature follicles. All these things are done by now only a homeopath. We don't refer this patient to a gynecologist to see what is going wrong. So she was subjected to a follicular study. And we found that the follicles are not maturing at the right time. So I started her on folliculinum 30, daily night for 15 days. And then again give a gap. What you should know about folliculinum, it is a great remedy for today's females, where many a time due to early menopause, there are joint pains, especially knee pain for people who have had early menopause. Dry skin during ovulation is another important indication of folliculinum. Low blood pressure, chilliness, lot of use of contraceptive pills, drained up constitution is also an indication of folliculinum. Premenstrual migraines, vaginal or vulvar pruritus before menses, or any dryness of skin which is before menses is one of the indications of the remedy folliculinum. Okay. So after giving folliculinum intermittently for 3 months, what we had is proper conception. The lady who had not conceived for 6 to 7 years, she had properly conceived. And today she has already developed, she has a child who's now maybe 6 years old, no, 6 months old. So what was the learning from this case? One is we need a systematic approach to get a breakthrough in such cases. Second, most important thing which I learned for myself and now I'm sharing with you is there is always a hormonal overlap. And the hormonal overlap causes masking of your constitutional symptoms. And we need to decipher those symptoms from the original constitutional symptoms to decide which remedy the patient may need. A new method of deciphering the hormonal overlap at every stage is very effective and the evidence-based for prescribing the remedy or the SAR code. So you now don't have to prescribe a SAR code empirically. You have to prescribe it on definite clinical indications. And that is what was now, for me, a very big breakthrough in understanding the indicated SAR code and the need for a constitutional remedy. Applying this new method of case taking and understanding of hormones has changed the way I look at things now in all endocrinal cases. The use of Pcos repertory and the materia medica has actually given us a strong boost now, where you have the collection of all the symptoms, especially of that particular related pathology and all the remedies which our great teachers have already worked on and given to us in some secret corners, now have been surfaced in the way of literatures for us to use. This is now helping us treat most of the pathological cases with confidence. We don't have to depend on different specialties because the microscopic study of these pathologies is already being done. That is what is the new thing that is going up, and slowly, maybe within few months, I'll be coming up with a full course in understanding different conditions, especially related to PCOS and infertility. Until then, we can have this, and you can give me your comments about this, and let me know how you feel about this new approach. So I guess we can take up questions now.
Yes,
the whole
sir.
idea was to tell you the newer approach that we have done, and I know I must have stirred a lot of minds by now, and I'm ready to take them on directly. So over to you, Manali. Let's
Yes, sir.
start with it.
It was a wonderful session, sir, with the methodology that you taught us today, because how many things must have gone ignored during the case taking, and very minute details that should be considered according to you was very helpful, sir, to all of us.
Thank
so,
you.
So there are few questions. One
Yes.
was regarding, Joanna had asked, can one use this method just with the book, or do we need a specific thyroid repertory to do it?
The book has the repertory within it.
Okay. Okay. And
there's no way. You will not get it separately.
Yeah.
You will get it along with the book.
Yeah. And sir, one main question what everyone was asking, when you said we need to give thyroidinum as an intercurrent, what potency generally should be prescribed for thyroidinum?
Again, I'm telling you, if the patient is, you see, thyroidinum is a well-proved remedy. Okay. So if you get complete indications at the level of mind, at the level of generalities and peculiarities, prescribe in a higher level. But if you are getting only clinical indications, okay, then you prescribe in 30 or 6x. That is the potency that I use.
Okay. Okay. And sir, one question was by Dr. Shruti. What to do if there is no symptom and reports show autoimmune thyroiditis? Should we give only constitutional at that time?
What's it? No symptoms?
No symptoms as such, but when a scan was done, it indicated autoimmune thyroiditis. So should only constitutional be given at that time?
Yeah. I will tell Shruti that take the case paper, go through it, and you will surely find some. This is what exactly used to happen to me earlier, because you used to not see symptoms because we are in a way looking for symptoms which we are taught the way we in a case taking. But now when I'm telling you, since puberty, since this disease, past history of moms, past history of tuberculosis, you will see something which we have been left out. Am I clear to you?
Yes, sir.
So don't say there is no symptoms. You will always have symptoms in relation to this. And if at all you don't have any symptoms, please give the remedy of the constitution, and that will stir some kind of process in there. And that is one remedy that you need to give at that time. So you have to wait for it to stir a kind of set of symptoms.
Yeah. Sir, one more question is there. Till what time we should follow up with the patient to understand that it is a complete cure for thyroid?
In cases of autoimmune conditions, you follow the patient even if he's better for at least 2 to 3, 4 years. And in other conditions, you can stop the treatment, but ask the patient to repeat the TSH every 3 to 6 months and keep a track of the patient till the time, at least for more than a year, even after you have stopped the constitutional remedy or the indicated thyroid similimum. And I'll tell you that in most of the conditions, you will be able to even predict where the patient is going to have the recurrence.
Okay, sir. And
so in such cases, you can tell the patient that if at all you see these kind of symptoms, you come back to us. And you will see that the recurrence is because of some phase that is changing. A lady who was normal has gone into a menopause phase. So you can use the phasic remedy at that time and still get the things back to normal.
Okay. Yes, sir. Dr. Dipali is asking, does severe hirsutism also get cured with this approach?
Hirsutism, right?
Yeah.
I did not mention any cases of hirsutism, but we have many cases which have been treated of hirsutism where this has disappeared. And we have a whole series on sarcodes where we discuss about cases of hirsutism. And we use the same hormonal filter chart, which I've told you. And that is one that helps us in treating those kind of cases. And we get hirsutism also reversed.
Okay. Dr. Chanda has asked a question. Why did you give Drosera 1M potency and not in X potency?
I was waiting for this question and I'm not surprised with Chanda. See, this is understanding that I developed on myself only. See, Drosera, when I read about Drosera, it is written that it is for past history of tuberculosis in the family and then somebody develops goiter afterwards. Okay. So this is more like a miasmatic tendency that is existing in the family tree. If you need to remove a tendency, it will never happen with a lower potency. You have to give the higher potency as mentioned by Dr. Allens in his book, Allens Miasms. So this remedy Drosera is more anti-miasmatic like a remedy rather than a remedy of the constitution or the pathology. With the understanding of Dr. Allens in his book, Allens Miasm, where he talks about using higher and higher potencies to remove the miasmatic traits, I used this potency and found it very effective in clinical practice. I wish you should read the book Allens Miasm. He is one who has done great understanding of the miasmatic classification of miasms by chronic disease by Dr. Hahnemann. And if you understand Allens Miasm, I guess you will be able to treat most of the pathological cases with knowing and with effectivity.
Yes. And sir, Dr. Chanda has one more question. Can we get this thyroid and PCOS repertory in a software form?
Thyroid repertory will be shortly coming in software form within a month or two. And PCOS repertory and a book will be in next 6-8 months. I am going to release my work on PCOS. It was just a prelude for you. And with that, you will get the software and the repertory together.
Okay. Thank you, sir. And sir, Dr. Bhanu is asking, thyroidinum in what? No, sorry, not this question. Dr. Yamini Bhagat has asked, many young girls nowadays don't get menses for months with obesity. Constitutional remedies help other complaints, but don't bring periods. Kindly advise.
Good, very nice. This is all answered in the book of PCOS, but I'll tell you, whenever there is a long-term amenorrhea, it is not thyroid that is at stake, it is also the anterior pituitary. So if the patient who has had long-term amenorrhea, that time you need to give anterior pituitary and thyroidinum, anterior pituitary and thyroidinum intermittently for a few months with a gap of a week in between and stimulate the anterior pituitary and the thyroid together and then give the constitutional remedy and you will see the change happening with the patient. So you need to understand the endocrine very nicely. So my dear friends, especially who are treating endocrine cases, you need to understand the endocrinology properly. So you will understand how to use sarcodes also apart from only the other indications. So do this and then you give your constitution and then you will see it.
Yeah. And so what is the prognosis of Hashimoto in children?
Hashimoto in children, I think you have to treat for at least 4 or 5 years to have considerable good results. And we have very less cases, but those cases we treated, those cases we had to treat for 4 to 5 years to have good results. So if you can make the patient understand that he has to follow this for such a long time, then I guess you will have good result with such cases. You need to use strong anti-miasmatic remedies too. So remember this. And all those people who want to treat this, please read Chronic Disease and Burnett and Allen's Miasm.
And so one last question. Dr. Ashish was asking, can anybody on allopathy for more than 10 years be treated for hypothyroid?
Generally, you know what, I don't love snatching those cases. If the patient is treated well and controlled well with that remedies, don't pull such cases. We have so much of thyroid in the population that you can only take those cases which are not doing well with those remedies, especially if a patient has got adjusted to the thyroid medicine and he has no problem with that, don't push homeopathy in him. But those people who are newly diagnosed, those people who are not controlled with allopathic medicines, they are the best cases for you to see results. You understand? Unless until the patient wills for it, has a will to take the remedy, don't push homeopathy into it. That's my personal belief. You can still try on it.
And one question is there. Some authors mention anterior pituitary 200 helps in who are taking L-troxin. Is it true?
I didn't understand the question. Helps in
anterior pituitary helps people who are already taking L-troxin as a medicine.
Listen, most of the patients are already taking L-troxin.
Yeah.
Isn't it?
Yes.
Then
Yes.
how will you understand this? You understand that if
Yes,
a patient
sir.
on and he is already taking L-troxin. So this kind of statement is not significant here.
Yes.
Understand?
Yeah. Sir, potency related questions are there a lot, sir. What is the scope of LM potency in thyroid cases is one question.
LM potency I will use only if I use it as a constitutional remedy, but listen to me very carefully about this then so that you will understand why I use X potency a lot. See, most of the remedies that generally come in thyroid related disorders as a pathological simillimum may be calcare iode, bromium, iodine, or natrum muriaticum. All of these are some kind of halogens and salts, okay, which has some affinity to thyroid gland. You understand? Even
Yes,
spongia,
yes.
for that matter, which grows under the sea, has absorbed some amount of iodine in it. You understand? So all these halogen groups, they have a good action on the thyroid gland. Now, for these remedies, if they have an action on the thyroid gland, they need to be present in a pathological form to stimulate that gland. What we do is stimulation of the gland. You understand? So if I have to use any remedy which is a pathological simillimum, I will see that the remedy should have some content of the medicine within it. And the only way that I can be sure that the medicine is there is when I use in X potency where there is some amount of medicine content. And that's the reason you see most of the reports have changed in few months. Within 3 months, within 4 months, you had complete reversals because it is a direct remedy which is acting on the gland directly. That is what now I have deduced after using it. So now when you have so much of confidence where the pathology and a pathological simillimum acts at the level of the remedy which is existing in small proportion, you don't have to go to the dynamic potency. Otherwise, LM is the potency that I use most in my practice, especially in different pathological conditions. But in thyroid, I'm using the X potency specially. When I talked about Pcos, there you didn't see I've written anything in X potency because it is more a pathological as the constitutional simillimum. It will be more dilutions and LMs that you will see there. But in thyroid, especially, I'm using because there is direct correlation with the pathology and the substance which is used. Am I reaching you? Like, for example, I'll tell you, this is like if I have to natrum mur is the constitution that come in thyroid. And you have given nitramur 200, 1M, 10M, and you didn't get good results, or you tried LM and you didn't get good results. Please go to nitramur 6X and give, and you will see excellent results in the same case. That is what I have verified in my practice, because only in thyroid I'm talking about, and not in other conditions. In thyroid, if your existing remedy has a halogen group within it, use it in X potency. If your even the LM potency is not working, or your millisimal scale is not working, or your dynamic other potencies are not working. That is the efficacy of 6X potency that I have found. Now, this is something which I have found in clinical practice. I leave it open for you all to use it in your practice and see and give me your feedbacks too. I would love to include it in my literature also, and it will be a learning for everybody. This is not something which has been complete, but this is something that I have discovered so that you can also use it and share and even come back with the feedback. That's what has been happening for the last few years with whom I have shared. So I welcome your group to even work on this and can give me a feedback about this, whatever I feel, and we can have changes accordingly.
Yes, sir. Sure, sir. And yeah. So Yeah, I guess we are off with the questions. And this is a thyroid related webinar, like musings today and not PCOS related. Maybe sometime again in future, we would have a PCOS webinar, musings with Sir, of course.
Yes.
Yeah. So thank you so much today for coming. Yeah, so you.
Yeah, Manali, you finish it.
Then yeah. Thank you so much, sir, for coming today on our request. And it was a very wonderful session with all your approach and your methodology. I guess it is going to help us in the long run in our clinics and in our practice as well. Thank you so much, sir.
Thank you, Manali, and thank you everybody for listening to me patiently. And I'm very excited with this new group, your Healing Harmony and what musings, homeopathy musings.
Homeopathy musings.
Would love to hear a lot about y'all and your work in this regard. And sometimes I would like to listen to all you speak about something which I really would love to know from you and learn from you all too. Thank you very much. It was a pleasure talking to you all. And bye from me. And feel free to write to us anytime if you have any difficulties. Okay.
Sure, sir.
Thank you.
Thank you so much, sir. Thank you.
Thank you.
Yeah. Bye, sir. Thank you. Have a good day.
Good day to you.
Bye, everyone.